I'm gonna call this meeting to order at 11:39. My name is Pauline Reyes and I'm the chair for this commission.
My name is Marina Medina.
Earl Medina.
Gerardo Montemayor.
I'm sorry, Karina Masi.
Freddy Guadalupe. Yeah, I'll pass those out.
Richard Chamberlain, Loretta Public Health.
Erica Lopez, Laredo Public Health. Catalina Oero.
Andres Velasquez from the Office of Congressman Henry Cuellar.
Nicholas Guzman from the office of Henry Cuellar.
Juan Gutierrez from the Office of Henry Cuellar.
Clara Gutierrez from Scans Domains.
Clarissa Carrillo with Scans, Jackie Caballero Scan, Linda Llanos, Travel Detective Behavioral Health Officer.
Elizabeth Alonso de Arial representing Laredo once against Drug Drive.
Armando Duarte, West Care, Texas.
Eva Ortiz, West Care.
Jacob Rios, American Public Allies and West Care.
I'm Eddie Bill with Wesker. Thank you.
Juan Perez, Laredo Fire.
Okay, we have a couple of guests coming in. If you wouldn't mind having to introduce yourself so that we can have it for the record, please.
Francisco Women with Scan.
Carolina Osa with Scan.
Madam.
Laura Mendez with Cook County Judge's Office.
All right, so thank you all so much for joining us today for the Laredo West County Drug and Alcohol Commission. It is Wednesday, July 10th, and again, we invite you all to grab food and to kindly RSVP prior to the meeting. Our next meeting will be on August 14th, and so we would hope that you all are able to join us. We don't have the invitation, however, if there is anybody here today that would like to do a quick prayer or thoughtful message, you're more than welcome to. If you kindly want to raise your hand, I'm not gonna pressure anybody, but if anybody is willing to want to say a quick prayer, thought, or remark, we would kindly appreciate it.
Okay, thank you, bow your head. Lord, thank you for having us get together. Give us the strength to make good decisions for our meeting. Bless everybody that's here and bless our home. In Jesus' name we pray, amen.
Thank you. Ms. Angie, was there anything that's needed for public comments?
No, no public.
Thank you. If I could please have the commission members review the minutes for June 12th, and if I please could, if there aren't any corrections, may I please have a first and a second?
I'll first.
Oh, okay, 1 second. I have a first by Gerardo Montemayor, and I have a second. Right, getting a pen here. By Ms. Elizabeth Alonso Villarreal, thank you. All in favor say aye. Any opposed say nay. Motion passes to approve the minutes as written for June 12, 2024.
Madam Chair, may I make a motion to bring up any, I'm gonna leave, I don't know if there's quorum for voting, but I'm gonna have to be excused, no later than 12:30. I wanna see if we can move up, number 8, if it's a possible action.
There is no action, it's just presentation.
There is no action. Perfect, thank you.
There is no action.
Said nothing.
Thank you. There is no action for this meeting. We are going over a couple of reports, beginning with Dr. Chamberlain. If you would like to give us your report.
Absolutely. Good morning, everybody, and thank you so much for being here with us. I have a couple of items to discuss. Most recently, and thank you to the individuals who were present at the Family Fentanyl Summit hosted by the Drug Enforcement Agency, DEA, just a few short weeks ago. Thank you to fire and police and all the community agencies that were present, especially on the Thursday night before. It was a very powerful event to be part of. And there was a lot of sensitivity that was needed to be implemented in those very sometimes tough discussions, but nonetheless, it was beautiful to be able to connect with those individuals and answer questions that they may have pending. I know I was able to provide subject matter expertise on how to get a death certificate that's been in looming since October of last year. And so from one day to the next, we got this death certificate that was being requested of the family. So it was great that we were able to connect with those individuals. Of course, unfortunate in the circumstances of it, but nonetheless, it was very powerful. And I know Ms. Marina was there, and there was a request that was made by the audience. If you could kindly remind me of that request so that we can share it with the committee.
Oh, yeah, they wanted to know if we could update the website, because they said that it was very difficult to navigate through it, to get information when, somebody's going through, their loved one being, using substance, like in substance abuse. So they wanted to see if they could get more information, maybe like a quick link, to it. And I told them that we were already working on it, that Jaime had already sent, us requests to put in that information. But I was able to address it.
Thank you. And I appreciate that. I know that's something that Ms. Pauline is working with Jaime, and they'll probably share an update on that in a few more minutes.
Frankie wants to say something.
They also mentioned of having like the president when they had Frank P. file. I think before they used to have one with all the agencies and organizations were there. They were that some people may not have access to internet, and then so it can be distributed or passed out organization.
Absolutely, and I know that's something as a committee, that we can come together. And as mentioned, Colleen and Jaime are working on that, but you do have the resources of Laredo Public Health to make sure that it comes about. But we are as strong as the information that is provided, so we want to make sure that that information is flowing in and not having to tackle down. So we just want to make sure everybody is very responsive to those communications.
So can we designate somebody right now for all of us, all of our agencies, to be email submitted, just basic name?
We have already
If it's
pushed that out.
You
We
have,
pushed that out through our PIO, Mr. Jaime.
Yeah, so Ms.
so I
Angie,
don't have your information, so maybe if you can share it, then I'll send it out today.
definitely, yeah. I know Ms. Angie last, or prior to meetings ago, she pushed out to the committee members, a link, a form. So you all would fill that out, and that's how I got that information. I know Ms. Conning was gonna mention a little bit. Yes,
Yeah.
Ms. Angie.
Angie, could you resend it?
Yes.
Yes, please, that way.
So yeah, as a matter of fact, she'll resend it because we only had about 10 to 11 agencies sign up when we know that SCAN's done a resource book, and their resource book has a number of different agencies. What we're trying to do is make it very accessible to everybody and easy to use. So we are working on a PDF form. We are working for something that's clickable, hyperlinked, and also where it's a scannable QR code, where there is no ands, ifs, or buts. As a matter of fact, just yesterday he was showing me what he had, and what we're gonna do, we're gonna go the extra step and do it in a form of where it's prevention, and there's presentations that are being provided by Marina, myself, or SCAN, or anybody who does presentation, prevention, or even Pillar does prevention presentations. And then we're gonna go into intervention, and then we're gonna go into treatment, and as it goes through the process. But I know that we have Tropical Behavior who will do an assessment, and then if anybody else is doing assessments, please we wanna put you where you belong in the step of recovery, and we're gonna take it all the way to recovery. So again, with that said, with Dr. Chamberlain, the information that we have is you all bringing us that information and us putting it together so that it's accessible for our community to be able to use, so that when they do have this difficult situation, that they don't look at a piece of paper and they're lost. It's something that while they look at it, they can easily maneuver through it and just say, I'm gonna call this person. And so we're hoping that we're able to finalize that maybe for the next meeting. With that said, we're also working on a PSA for radio, television, and billboard. Next month is Overdose Awareness Month. And so we're hoping that we're able to push through with all this information, the campaign on behalf of the Drug and Alcohol Commission, alongside the City of Laredo Health Department. So again, any ideas are definitely welcome, but we need action, and so we need action from everybody, not just, a single person having to carry this large task, because this task might be something that's taken care of, but it's gonna go out into the community and hopefully be able to use on a timeless manner, because it's gonna be continuously.
And it's drug and alcohol, right?
Yes.
Yeah, I'm pushing for the
Yes,
alcohol side, yes.
If I can share, they did ask for it to be updated recurrently, I don't know if that's something that.
we were aiming to do it on a yearly basis, just as long as the way that SCAN was doing it, but when it comes down to it, it's a matter of getting people to commit to it. So that's why I say, like, this time around, I'm committing to it, but next year, hopefully maybe somebody else can commit to it. But somebody from this commission needs to. I know that we had started off with another commission member. We've seen absence from that commission member, so we just need to continue to have somebody who's active. Because yeah, everybody can say we want it updated, but if someone's not gonna handle it, I think the best time to do it is before August, and I think that should be our goal before every August to get that, submitted. And we're only going to include whoever is submitting their information, because it's harder for us to make those phone calls to agencies that may or may not exist. So again, I appreciate you all being here, but we're trying to make it as easy as possible for the community to be able to use those resources to help their loved ones. But other than that, Jaime did meet with me, and we were able to toss some ideas around. And then we're working on getting a PSA with everybody's support. I will be doing the storyboard and getting it approved by the City of Laredo Health Department, and then making it as easy as possible so that we can start rolling out with it. But other than that, I think the City of Laredo, Dr. Chamberlain, Jaime, and everybody on your team, by helping us out, because I think the ideas are said, but they execute them. So I want to thank you all for taking the time to do that.
Absolutely. And count on that email being resent out to the group before the end of the day, so that way you're able to help populate that, and then to also share within your networks with other individuals, organizations, agencies, nonprofits, whatever they are, that are here to help elevate and support this mission that we're all on to prevent drug and alcohol associated mortalities or situations that we're facing in our community. Excuse me. Moving over to the drug-free world, we do have these little pamphlets that we just got in. They talk about alcohol, they talk about heroin, they're in English, they're in Spanish. But these are a great resource tool that our public health promotion specialists are utilizing when they're out in the community. If you'd like to connect and to be able to amplify this specific movement, which is vidasinDrogas.org or drugfreelife.org, please let us know so we can help connect you with the executive director, who our public information team has already established on contact with this organization out of California. They're out of LA, and they're all about getting us resources and helping to maximize the availability of these types of resources and just increase the awareness around preventing usage and misusage of illegal and prescription medications. Next, we did discuss last week the overdose response strategy. Last meeting, the overdose response strategy meeting that we attended, and the OFR tool, which is the overdose fatality review and equity tool. And we have reached out, and we said we were going to do something this meeting, but we reached out to DJ Geary, who is the public health analyst at the ORS, the Overdose Response Strategy Network, to zoom into our next meeting, if allowed by the committee, so that way he can give us a demonstration of how powerful this tool is, especially when we're looking at those social determinants of health, and as we're adding all this information to a GIS map. So not only, of course, are we building this list, right, of the resources, but then we can also link that list to the map, and then be able to identify the social determinants of health that may have contributed to that overdose, in whether it's a mortality or just a situation that they were able to be revived and recover from. So that way we're able to effectively strategize on the initiatives, on the programs, on the grants that we're going to go out and look for, with just an overall amazing tool. So Jaime pushed out that communication to DJ Geary, and we're hopeful to hear back from him within the next week, so that way we're able to make a request to place that item on the agenda for the next meeting, so that everybody gets the opportunity to see what I saw and just how amazing this tool is. And I don't want it to go on much longer, since it's already been, we're going 2 months later from that event. So I want to make sure that we continue to grind those gears and implement this or utilize this tool in our community. So that's forthcoming. I also wanted to advise everybody that on June 24th, we did have that item agenda that was brought forth by Victor Vasquez at the last meeting, and council wholeheartedly supported that. And with us at Laredo Public Health, we've already contributed our in-kind support match to the program. I can't speak for fire or for police or for the other departments, but I know that they're working on it because it was a council-driven objective. So we're very happy to be part of that, and I'm hopeful that, I think the submission already happened, if I'm not mistaken.
Yes.
And that it is successful, and that comes to Laredo, and that just helps to increase the amount of resources that are available in our community. So we were very happy about that. I also wanted to mention that the overdose response strategy as a whole was typed up and submitted to the Healthier Texas Summit as an abstract, and ultimately got approved for a discussion session, if I'm not correct, right? So thank you very much to the community for the continuous work, and I actually have a ledger of all the harm reduction strategies that have been employed and deployed since the end of 2022, and there's quite a bit. So we have been very busy, and that should continue. We should not falter, it should not come down. We should just continue to add to that ledger of all the different harm reduction tools that we are activating, employing, and ideating on in our community. So that Healthier Texas Summit happens in October. So if you have the opportunity, it is an amazing showcase of public health here in Texas, but across the United States that does come in, and we will be taking the good work that this community is doing, that this group is doing, to the stage of Healthier Texas Summit, and providing this in a discussion format in a breakout session to the participants that will be there. So thank you all for that. And lastly, I wanted to mention that on the lines of substance use disorder, mental health, we are having our final 988 Tecolotes game this Saturday, July 13th. Do you know what time it is? It's at 8:30, so if you'd like to be present to help elevate the 988 movement, mental health, we ask for your support. We can get a couple extra tickets if needed, so that way you're able to amplify and move around, and we have some goodies that we pass out that are little.
We start at 6.
We start at 6, okay. We have some little stress relievers that are baseballs that have the 988 that we're handing out, that we're throwing out throughout the game. And I know it has been such a success to be able to get into that population of the baseball individuals as they're coming in, or the baseball fans that are coming in, to be able to maximize that message of 988. So thank you all very much. I'll pause there for any questions.
When was that again, the date? I didn't catch the date.
It's this Saturday, July the 13th. This game.
Is the fourth one? I'm not sorry, the third one.
The third.
Do you guys have a registration form, or like when you register? Or
No, you can just get in contact with me after, whoever would like to join, and then we can coordinate tickets and stuff, and it's gonna be like, it's a setup of like 5 tables. We put out our information for people. It's just education on 988.
Any other comments? Thank you very much, Dr. Chamberlain, for your report. I know that Ms. Alonso had asked, is this in English by any chance?
Yes, it is.
There is packets, it's a toolkit. We have them over here.
Okay.
That's just to showcase what it is. If you guys are interested, we can give out some toolkits for you.
Okay, perfect. Thank you so much. Appreciate that. Moving on to the detox facility update, Dr. Martinez.
Yes, so as of today, we have 112 admissions. We continue to get referrals, but as we've said before, right, it ultimately has to be the individual that's ready for services. We're at about 250-ish referrals, so probably about half of the referrals that we get, 50% of the individuals are receptive to services. We are seeing quite a bit of individuals that come in with alcohol. So just as a reminder, so I did get a couple phone calls yesterday, people asking where they can send someone who is just alcohol. We also do alcohol, so it's alcohol and then the other substances. Today we did have an individual that we weren't able to treat. We had to send him to the hospital. He had a 0.298 blood alcohol level, and so just for reference, 0.30 it's alcohol poisoning. 0.08 is legally intoxicated, and at 0.16 we blacked out. And he did mention that, he says, I think I had a seizure earlier this morning, but what it was a blackout. At the time we got him, it was at 2.98, so we did have to send him to the hospital. We did advise him that, once they got the alcohol level, down, then we can admit him. So we are seeing quite a bit of, individuals with alcohol, out in the community. As a reminder, we are a 24/7 Narcan distribution site. As of, Wednesday of last week, right before, a week ago, we had already distributed 75 Narcan doses, and we continue to get family members that come. They let us know, my family member needs to come in. They don't want to. I don't know what to do. So education on resources, outpatient in the community is given, but we also then educate them on, based on the substances they're using. We distribute Narcan to them. We'll let them know how to use it. Sometimes they let us know, I don't know what they're using. So we'll still give them the Narcan and say, if you're not sure and you believe they're having an overdose, this could save them. We do have, we will continue to do admissions. I do want to point out, I believe last meeting, it was brought up to the attention of Dr. Chamberlain and Billy's colleagues that, we had let you all know that there was not a wait list, and that you all called and there's a wait list. We don't have a wait list, okay? Something to understand is people don't, we've said it's not like a drop-in center. You just don't show up and you get admitted in that moment. So probably the information that they are getting, or most likely the information that they're getting, is from the time individuals, decide that they want to come in and we begin the process. It can take anywhere from a week to a week and a half. Because as we mentioned before, and Dr. Reyes came and explained it, we do have to clear the TB test. The TB test can take anywhere from, 3 to 4 days to get cleared. And if we're waiting for, blood work to come back, because a lot of our patients do have, chronic debilitating illnesses that we're also treating. We are doing, chronic illness stabilization at the clinic, and we're waiting for that. So that process there takes about a week. Now, also keep in mind that the majority of the individuals, Jessica calls me today, that moment, the minute she calls me, we are sending the referral. We don't have them, they don't have to come to the clinic and pick up the referral for the lab work. We send it directly to the lab. We let them know, go to this place, they'll do the draw, and they don't go. Dr. Chamberlain can say that we probably have about 100 individuals that have not gone to do the blood work, right? Because we work with the public health, and then they say, well, we have these many people, and they're calling and we're calling. So it is not a wait list. We don't have a wait list. The minute they call us and they say, yes, I am ready, we initiate the process. And then we tell them, tentatively, this would be the date that we can do your admission. And then also keep in mind, if they come back positive for TB, that's a whole other process, and we have to clear that. But the process for admission, from the time we start it to the time they come in, can be anywhere between a week and a half to 2. And we've addressed this, but there is not a wait list. We have the beds available.
Then correct me if I'm wrong, just because I'm trying to understand. When it comes to these individuals who are going to get blood work or the TB test, there's obviously a wait time. There's a wait time because they're waiting. We're not holding them because it's out of their free will, correct?
Okay, so are you saying that you're considering that the wait list because they're having
No,
to wait?
it's not a wait list, but they're still waiting.
Oh, they're waiting, but right, at least what I
Because
consider a
we
wait
can't
list.
hold them.
No,
because
we
it's out of their
can't,
free will.
yeah, and
So is there any resource or agency, or is there any way that's where I feel like that it's falling through the cracks of them having to go back and use or get into a situation, or because there's just so much time between that. So is there anything that could, I don't know, I'm just throwing it out there, because I'm trying to get an idea, because there obviously is a 1 week time.
not for us. And Dr. Reyes came and explained to the committee, right, based on the protocols and based on, right, because we're not a facility that we can bring them in when something happened to them, yes, we can call 911, but there's been many situations where we're staffing it and we say it's not safe. And if somebody says, we have a protocol that will call 911, but there's situations that we don't intubate in our facility. And so there's individuals that if we were to intubate, we don't have the capacity to intubate them. And so by the time those 4 or 5 minutes that it would take EMT to show up, that person could possibly be brain dead. And so based on our medical protocols, we can't, not for our facility.
If I can-
sorry.
Sorry, if I can add, I think your question was more so, like if there's a program or somewhere that they can go to
Yes,
while
I
they.
mean, while they wait for
But,
the
I know
process.
that the detox might not have one, but, SCAN does have a recovery support program and a drop-in center where they can go and they can, ask for support. And then if they have cravings or they have the urge to use, they can talk to someone, while they wait for their admission to the detox.
Are you all able to transport to,
I'm gonna be honest, transport is limited because there is a limited amount of individuals, right? But there is a possibility that they can get transport. And if we can't provide the transport, we can look into resources, like having the bus tickets provided to them so they can get around, the city, as well as it's free of cost.
But is this like inpatient, they've stayed in it? Cause I think that's what she's asking. It's not inpatient.
Oh, no,
That's what
inpatient,
she's
no.
asking, where they
No.
can already stay while we
Right,
take them.
because for example, with our program, during the time that they are waiting to get admitted, our clients are freaking out because they know they're gonna go into detox. They want to use more and they do use more, they'll come into the counseling and they'll see their counselor and the counselor will try to stabilize them as much as possible to prep them to get them ready to go into detox. But during that week and a half that they're waiting, they're going into full panic mode because they know what they're gonna go into. So is there something that we can do in the meanwhile that they're waiting to get called in?
I think a facility where you're going to have a person wait there, no, but a facility where they can call and they can say, hey, I have a hundred to come with and go to talk to them or process what they're going through, because we are open 24/7, and they can call at any time and ask and talk to someone while they wait for that period. But a facility, I think that's,
Where they're waiting?
yeah.
I know, last, I think it was like 2 weeks ago, right, Margarita? I had an individual that called and they wanted services, so I did the referral form and I sent it to them. But, they also, because of the wait time, they were like, well, what do we do? So I called Grace Center and they said that they would take them. They would take them, if need be, but the person didn't show up.
And I will add to that because we have, now here's the thing, right, that the community and this committee needs to understand. When you're withdrawing, right, a place like Ray's, it's not gonna work for them because they don't provide the medication that is needed. And that's what has them using, that's where the anxiety of coming, and the majority of the individuals that come to us, they use right now, the 2 people that were admitted today, they were drinking and using right at the corner before they came in. Lindsay had to go out there and said, you're getting admitted, you need to stop. You're gonna get admitted, you need to stop right now because we need to be able to get you in, and if you're at a certain level, we won't be able to admit, which was what happened to one of them, and then the other one, got admitted. So, but yeah, we know that happens. You know, as a provider, I've been doing this for 20 years, you know, it happens. We know that they get anxious knowing they're gonna go into, whether it's residential detox, and they're gonna use more because they're thinking it's the last time I'm gonna use, and you know, I'm gonna recover and I'm not gonna use anymore. So unfortunately, that is the mentality. But
Is there any way to reduce the wait time?
And we've said it, reason is because we don't have control of how long it takes to get the results. Sometimes those results come in 24 hours, 48, sometimes they do. And when they do, as soon as we get them, we present them to the physician, he gives us the okay, and we call them. We also let individuals know, be on standby, you know, give us a good number. And we've used the counselors have helped us, we've called them and said, you know, at my scan, we've called them and said, you know what, your client is ready. Everything came in, we're reaching out to them, we went to go look for them, we can't find them. If you can get them in, we can admit them right now. And so that's happening constantly. Our communication with our partners is constant. I know with Bethany, we're doing the same thing that we tell them. everything already came in. And then, so we can bring them in, and so some individuals are being brought in within 2 to 3 days, other individuals it is taking longer, and it also just, it really depends on that, and like I said, Dr. Reyes had come and explained that, but this is our protocols, this is a process, this is what we got licensed for, so that's, we can't go outside of that, because then we will lose our license. I know other entities don't do that, but this is a protocol for this.
So we understand that, so it's not a matter of whether you're doing it or you're not doing it, I think it's understood. The only thing is what we're trying to toss around the idea is how could we make it better, or are there resources in our community that can assist while they quote unquote wait, because there's a waiting period, it's not a wait list, but there is a waiting period, and I think within that time frame. You said it, they wanna go use, or they say, never mind, I like this too much, maybe, I don't wanna do it now, or maybe I'm okay, I can do it on my own. There's just so many different things and factors that are going on, so maybe providing, scan that resource, and if there is anybody here that can, contribute to the success of getting them into the detox facility, then, speak or hold your peace, because what we're trying to do is trying to gather everybody's resources to help these people that are needing this help, but again, we know that it's in their free will, and it makes it the most difficult, because again, while the TB test or the blood work, it's costing someone, whether it's free or not, it's costing someone.
No, it's
So
costing, the center pays.
we don't want to use those resources for somebody, or have that wait later because there aren't those resources available for these people that are wanting to. So I think we need to kind of figure out on the assessment where we're at, or how to direct them to an agency.
Okay, we've been working with the Roots, is the scan drop-in center. And what we try to do is we refer them, we take them, they do the application, and then we take them to do the lab work. We are with them through all the time, the waiting time. So I think it has been working really good. And then we get to talk to them during the waiting time, and we transport them to the services. And when they complete the program, we help them to the outpatient, to the inpatient, or to the MAC programs.
Yes, which is the program that I was, which is the medication assisted treatment for
We were talking this morning with the director, Roberto Peña of Serenidad, and we've noticed that has showed the most success, because the prevention specialist is taking them, and that's when we realize that they actually make it to residential.
And I think that that's a definite, thing that's necessary. Which is the next thing I'm gonna ask is, if you don't have those numbers, I know Dr. Chamberlain's big on numbers, and I think we all are, because if we can see it by the numbers of how many people that you all get to see that are referred there that are successfully admitted, that would be a factor to making sure that that's the way or the route that we have to go through, and trying to see how we can get more funding for that program, so that it contributes to the success, because I know Margarita has clients that need to go through the process, but I think and I don't even know at what point law enforcement can get involved.
We have one female that completed detox successfully not that long ago, and then she was referred to the MAP program to get a prescription for Suboxone. My question to you all would be, do you follow up with drug tests to see if they're using any other substances? Because that specific female recently came back positive for methadone and for other substances, and she's getting a prescription for Suboxone, and that scares us because we know that now she's abusing Suboxone, which is prescribed, by using heroin, because she's coming out positive for methadone.
Right, so when we do our first and second induction with the clients, the first visit we do a medical evaluation.
Okay.
And then the second induction is to determine if they need to adjust medication. On the first induction, we do complete weight testing to see if they are positive for any other substance. Even if they are positive for any other substance, we work with them, because we can't just tell someone to say, stop using, it can possibly.
Is there a way that maybe we can connect and have maybe some sort of a consent for release information, so that we can have, so that you can have open communication with the case managers and the probation officers, just so that everyone is on the same page, so that we're able to get this person on the right track together?
We, I think I actually know who you're talking with the client who just got this interview scheduled already, but regarding the consent, if you guys send us a referral and the consent form with the
Okay.
referral, that allows us to kind of provide you information and share, versus us having to say, well, let me have the client sign and
Yeah.
whatnot, right?
Okay.
So watch the,
We can get that to you.
yeah, that would work out. I did wanna share that with the withdrawal symptoms, like if the clients are going to withdraw symptoms, they can go to the nearest emergency room as well. I know I don't wanna kind of jam pack the emergency rooms with clients, right, but, that is the best place to go if they are going through withdrawal symptoms. So if you have clients that are experiencing anxiety, shaking, vomiting, nausea, diarrhea, they can go to the ER. And not all the time, some doctors may prescribe, there's Suboxone at the emergency room, it just depends on the doctor.
Yeah, and we have had individuals that that's what we let them know, you know, if at the point that go to the emergency room, and then from there, it can.
Dr. Martinez, do you know the referrals that are coming through? Do you see more coming in from a particular agency or a particular
The
person?
majority are self-referred, but in terms of the agencies, I would say that, SCAN is the one with the highest volume, followed by Bethany, in terms of the referrals. And AMA, we're getting, a lot from AMA, because with AMA, right, they do the MAT program, but they're using, right, other substances. And so then they let us, they're gonna continue with the methadone program, but they're abusing sedatives or cocaine or other stuff, so then we're detoxing them from the other substances so that they can continue with that. But, circling back really quick to the labs. It's not like you came today, I sent you for the labs, and then you didn't come in when you were supposed to. Our physician, and he said it when he came here, those labs, they'll be good for 90 days. If it went like a day or two over, he's fine, but if it's been 4, 5, 6 months, which we haven't been there because we just hit our 5th, month mark. But it's not like, we did it today, you didn't come, I told you come in Monday, you didn't come in Monday, and then you decide you wanna come Wednesday, which that happens a lot to us. We have a lot of individuals that will say, okay, everything goes well, we're gonna bring you in on Monday, but be on the lookout, because if they come in sooner, we'll bring you in sooner, but then the day comes and they don't show up, but then they show up a day or two later that, I thought I could do it on my own, but no, now I realize I need it, or a week or two later, and then we bring them in, because then that's already there. They don't, the TB and that will be good for 90-ish days. Also other agencies, there are other agencies that do a TB test for their program. We have already spoken with those agencies and we've said it here. We can use their TB test. And so individuals that will do the pre-screening, and so there has been situations that the physician will say, well, we'll have them, they have a TB test, that's the most important, we won't worry about the other blood work, and we'll start treating them. If they start getting sick on us, then the health department has gone 2 or 3 times to draw blood at the center for those that we skipped that step, and then we wait and go from there. So, we've said it before, the TB is the most important. So, there's other ways, but again, it's just like I said, you all need to communicate with us, because you going to somebody else and saying, well, this is what's happening at the center, we won't know, right? But if you call us and say, this is the situation, and then we start to coordinate and we figure out how we can get them in, because ultimately I have to consult with the physician. And then in consulting with them and saying, this is the situation we have, this is what already we have, then we can bring them in, okay? But I need to know. You going to somebody else and telling this is what's happening, we won't know. But there's ways that we can do things, there's some things we just can't do, but there's ways that we can try and get it quicker. And we have had individuals that call us and say, we have insurance, if we go to our own doctor, we go to the hospital, we get them stat, will you validate them? Yes. If you are able to pay to go to a private provider and get them stat and get your results that day and bring it to us, then that's something, different. Because I said, we have all this. So there's ways we can do it, but we have to know.
For the individuals that are in custody, I know we talked about this the last meeting. Would you be able to send me the lab order form so that the judge can sign transportation orders so that the sheriff's office can transport the inmate?
Yeah, but again, you guys would need to call us to ask us because it has, yeah,
Well,
we did it over and
We
over.
tried that last month, but we were told by the facility that we could not receive the orders, that nobody could send them to us. And that's why the individual ended up being released from custody because we were
But
told
again, and
no.
I told you, call me, let me know, because if not, then we don't know. I don't know who you would have
We
spoken
did,
with.
we did.
To me, no.
No, not to the director, no ma'am. We spoke to the staff.
Yes, but I don't know what staff you would have spoken, right? Because we don't know, and we've already addressed it with staff to not have like the office assistant be the one give information, because they might not know everything that needs to happen. That's what we've told them. You get a call, transfer it to the intake specialist or to the manager, myself, because again, I don't know who you spoke with, and they might have not known, right, what can be done, what can't be done.
Could you address, manager's name and intake, person's name?
Yeah, and it's the,
Manager is me, Lindsay Vasquez. Y Intake Specialist is Miss Annalise Serrano.
And is she the only one, or are there several?
no, there's one.
He's the only one who's doing the referrals and everything, but again, we have the caseworkers who are also known how to do the process. But for a person to complete the referrals and everything and put it in the EMR that we have, is through her. But
If she is not available, is there anybody else that can assist us?
and the phone number is 956-679-2826.
And my number, I've told you guys over and over, I only have one phone. And you call me, you text me, I'm gonna answer it 24/7, I have. And that's 956-857-5120. So again, you know, if you're having difficulty, let me know. I have had family members, I have called me at 3:00 in the morning and I've answered it. I have had agencies call me off hours and I have answered it.
Can you repeat the phone again, sorry?
Mine is 956-857-5120. And the best way to ensure that I didn't miss the call is send me a text. Send me a text and say, this is Viviana Martinez, or you know, this is Gutierrez from SCAN. I need assistance with the patient. And that way I didn't miss it, and I will call you right back. And that way I don't, sometimes over the phone, you can't hear what that number was, and we'll call you, and then we'll coordinate and figure it out.
I have a quick question, regarding readmission. The client was admitted, right, stayed there 14 days, and then, was out, you know, in the community for 2 weeks or a week,
And relapse,
and relapsed, right?
right now we admitted the same person for the third time.
Okay.
Unfortunately, it's going to happen. We do not deny the service. If there's a bed available for them, we will. What we have told them also, we will look at the severity, but if there's somebody that hasn't got the opportunity to get it, well, obviously they would have to go to the bottom, but right now, you know. But we have individuals that have already come to us twice, and today, one of the individuals is his third time there.
I just want to mention that the client's been talking really good.
Yes, I do also want to comment that the communication with AMA and the detox center has been exceptional, and during that waiting period, we do try to connect them to a peer support. That way they're attending support meetings, because at our program we have support meetings every day. And then if it's not the support meeting, it's some other type of meeting, AA meeting, as well as attending church support groups as well. That would be, we try to provide them the resources, that way they can get themselves involved meanwhile they're waiting. And I honestly have never had an issue with the detox center so far. Mostly I get in contact with Ms. Serrano.
Yeah, that's our intake specialist.
And if she's not available, they leave a message and then she calls me.
And like I said, and when they do come, we do let them know what resources are in the community. I know that if they're not enrolled in AMA, well, we can't say go to support group, but we do give them the information for the program with Ms. Gutierrez at SCAN, and because we know those are available 24/7, we let them know what are the resources. But like I said, you know, I understand sometimes we call, but please let us know, because if you communicate with us and you follow that chain, you know, sometimes we call and that person didn't help us and we have to find somebody else. so that we can assist you, because our goal is to get them in there too, right? Our goal is not to say, well, I'm not gonna work with this agency, we wanna help everybody, also regardless if they already been at the center or not. Because we know that our population is going to need multiple attempts at, services, to get them, to where they need to be, and, and not be one of our other unfortunate statistics.
I have a question. Can you describe very briefly what's like the ideal referral process, assuming that the agency puts, the intensive case management part to follow through the case? Does it, first we have to email you a referral form?
And
What is
we
the
have the
process?
referral form, but we have people that just call us, and by just calling me and saying, I have Jessica Contreras, because obviously we need to speak with that person, so what we need from the agency is the name, a good contact number, and if you have an address, we'll take that, because when we can't get them on the phone, Ms. Serrano with Ms. Contreras and, caseworkers will go out and look for them, and they also go out and look for them when they're like, if their appointment is at 10:30 for admission, she reminds them the day before, she starts calling them the day of, and she's like, no me contesta, se arranca. One of the individuals, we los sacó from the Siesta Motel, because the mother said, got upset at me, left the house, but he's staying at the Siesta Motel. What did they do? Se arrancaron y se lo trajeron. We can't provide transportation, we're not allowed to, but we've been coordinating, like if they're from AMA, if they're from Border, from SCAN, Border has also been sending and transporting. But Pastor Thayes has been really good, even if they're not with them, and he's bringing them over, he'll bring, and also the families will go, well, voy con ustedes porque si lo encuentro entonces me lo traigo. So we're doing street outreach, we're going out there if we know, because we need to bring them in.
But the first step is just calling you, providing you the.
You can either email us or call us, we need a name, the individual's name and a good contact number.
Let's say for the homeless population, that we would be the ones going out to do the outreach. We set up like a phone call with them, or?
You can bring them, if you guys provide transportation, you can bring them to the facility. Some agencies are bringing them to the facility, I know Border and Scan are doing that. And too, they're bringing it to us, we do everything there, and then we're coordinating with them there.
Ma'am, I have a question. What do you all need, or what? Unfortunately, my cousin passed away from drug usage. But in California, it doesn't take a week for the intake, it takes hours. But it is a few good hours of wait time, but they get admitted that same day. What do you all need, or what would you need to do that kind of process?
The thing is that with our center, we do a TB test, and the TB takes 72 hours to get the results back, roughly. And then we also get a complete blood panel on them. So like I said, there's ways we would need to discuss a case by case, but on average, it takes us about a week to get them into services. By the time those come back and we get them in. But what we need is, we need the individual, we need to speak with the individual, because we do a pre-assessment to make sure that's what they need, that they need detox. And then we do the paperwork for them to get all those labs and the TB.
But there's no way to rush those tests, like the blood work at least.
The time that the mayor was here, he says that I think there was like a machine that they
No,
can.
an X-ray.
An X-ray,
Would
yeah.
be instead, so maybe we can contract somebody.
Well, we've been looking into it, but the X-ray is for those that already tested positive. You don't do it for it's for those that are positive and that we're needing the confirmation.
So you wouldn't be, there is no mechanism?
Like, right now,
There's no
rapid.
No.
The skin test.
That's
Yeah,
not right.
yeah.
I mean, that skin test comes out positive 3 days later, then you get the X-ray, then you have.
The health department does the blood, but it gets sent out to us.
And TB was implemented because we are one of the 9 counties in the 254 counties that has such a high incidence rate of tuberculosis in our community.
We are also
Other-
trying to, I'm sorry,
Go ahead.
we are also trying to protect other patients, but
And
also
the
the
staff.
staff. Because if by the end
There's
of
an
the
outbreak, we shut
your
down.
staff is all infected by TB test, then we have to shut down the facility, and all have to be quarantined for how many days, we don't know. So I know it's pretty like, how can I rush this thing, but this is the safest way for our community. Because if not, then everyone else is going to be having TB test positive by the end of the year for just.
Have you had positive? You have.
Oh, yeah, we have had 20-some, probably 30.
And then plus, well, a couple active had full.
Yeah.
But then there's a lot that are late.
No, the Latin, and once we get it, then they can come in with that with their treatment.
This has
But-
also been revised, of course, with Dr. Mateo
Yeah.
Reyes, but our only infectious disease doctor in the city of Laredo, which is Fernando Sanchez, our medical director here at Laredo Public Health, who also put his name behind.
We have
And
done
we
whatever
redu-
we
and
can
reduced
to
the-
expedite
we
it.
reduced the timeframe we have because we know of the significant severity of certain situations, but on the safety part, that's where our hands get tied. We just wanna make sure that the patient population and the staff population are gonna be.
In the
safe.
community, because by the time we find out if somebody's positive, and I was exposed, I already went home, I was already, and then,
And it would be different if the facility was, had negative air pressure, but unfortunately, the
We're
facility
not.
doesn't have negative air pressure, and that makes it that much more difficult to maintain high standards of infection control within the facility.
And some parents, I'm sorry, I did receive a call from one parent who was in the process of getting the TB test, and he was hysterical because he has to deal with it, so props to Detox, I'm assuming if I dealt with one.
oh yeah,
You guys deal with it all
we
the
get
time.
it every day.
And he said, he's like, I understand it's a process, he wanted to know if we could do anything outpatient in the meantime. He's like, but I do appreciate that they're taking the precautions, cause they didn't send to other places that they don't. So he's like, yes, they're detox, but a veces vienen peor. Why? Because they catch something while they're there, or now we have to deal with that too. So he was appreciative, he was frustrated with having to deal with the situation, but he was very appreciative that Detox was taking those extra precautions.
And so just to wrap up this topic, I appreciate everybody's discussion, and ultimately what I'm gathering from this is improved communication is what we need, but also with what you're working on with Jaime Colleen, is that an actual process flow map of these are the organizations that can help out pre-detox, and then detox and the organizations that can help afterwards. I don't think that process flow and actual visualization exists.
Yeah.
So once we can put all these pieces together, we can have that as part of the document, like here are the schematic of how this works, so people have a visual representation of what to do and how to connect within that document that we're prepared.
And that's actually what I want, and as a matter of fact, I was gonna suggest, and so that everybody that's here, that nobody that does not come into these meetings and is not active in these meetings will not be put on that process, on that flow chart. Because I think that if we try to get somebody else, then that's gonna be that miscommunication of not getting a hold of Dr. Martinez or the detox facility. So as a requirement to be on that flow chart, then you will have to have some form of representation or attendance to avoid having these issues. But anybody and everybody who is here can actively be a part of that flow chart. And again, I think I completely understand. I mean, if I'm a germaphobe. When it came to COVID, it was a major problem. So if it's an issue of safety, then I completely understand. However, I think it is that frustration of wanting to help an individual or a loved one or somebody who is wanting and willing and not being able to be seen almost immediately, and then having things change within that time frame. So we'll piece it together with SCAN and know which programs you all have in between that wait time, so that they are able to have that willingness to want to go through that process when it does get to the detox facility, and hopefully not having them come back to the facility, but that they are successful, which is the next part after the detox facility. If there is a SCAN or border region program or any other program or agency that is here that is able to assist with the after treatment, the aftercare, then we definitely want to be able to get them to the right individual so that they're successful. Because again, it's a resource of financial and funding that we don't want to misuse either. So thank you, Dr. Martinez, for your report, and I'm glad to hear that some agencies have had very good communication and success with the detox facility. We hope that everybody is able to do the same, because I know that there are other agencies here that are, or agencies or individuals that are willing to work and send individuals to the detox facility. Right now, we don't have any discussion and possible action. Or may I, if there are any comments for Dr. Martinez, then we'll move forward to, the stakeholder agency updates and presentation. Mr. Garcia was unable to come in, so he sent us Miss Monica, second best. So then we'll go ahead and ask, Ms. Monica to give us a quick report on what you're all doing. I did see fire this morning.
Okay.
All right, so I just, okay.
Which we appreciate the support. So thank you for the opportunity to share a little bit of the update of, so many of you might be very familiar already with the project. Bear with me if you haven't heard about it. I want to share some details on our expansion. So as you know, the core of our mission is to provide, the essentials of food and shelter. But we also provide other supportive services in order to promote dignity among the homeless population and ultimately instill self-sufficiency. And our ultimate goal, of course, is to house them, right, and stabilize them. I'm very happy to say that I see a lot of faces that, from agencies that have a very active role in our facility. So I think there is a level of collaboration that we hadn't seen before. And, regular visits, like weekly visits from your agencies to provide information, but also enroll clients to your program. So we really, really appreciate that support. And in regards to this expansion, so Bethany House is expanding to a facility across our dining facility, which you're probably the most familiar with, the one in the corner of San Bernardo and Hidalgo. We're expanding. We're in the process of construction of a new building. The goal is to relocate all the services for the male single adult population, which is the more chronic, the one that requires the most intensive case management. We're relocating those services to the new facility, and meaning that we're gonna have a resource center, which I'll expand on that. We're gonna have an expanded dorm. So right now we have 20 beds and we're doubling to 56. We're gonna have more showers, more restrooms, additional space in our dining room, which will serve only the people that will receive services at the center. We're keeping the operation in the original dining facility. With this change, this is allowing us to use the existing facility to only serve women and families, which was very important for us to not mix the populations. Ideally, if you visit other homeless shelters in other cities, that is the setting, but we just limit it, right, with resources as we all are, so that way we have the combined populations there, but now this is giving us the opportunity to just target the services differently. Like I always say, we're not only expanding the capacity, we are also changing the way that we can address homelessness. And how we're doing this is through a resource center. So we're gonna have a facility where we will have office space available for all of you to provide your services at Bethany House. We're in the process of maybe figuring out the schedule. So let's say maybe one day, Tuesdays, maybe SCAN will be there. Wednesdays, Border Region, maybe Roots will be there. So but actually we're not waiting for that to open. We're already running a lot of the programs. Already, as cramped as we are in the facility, we're already trying to run these pilot programs of agencies providing services on site, which, as you know, with the homeless population, you have a challenge of transportation, cell phone. So it is very, very frustrating for them that in order to secure housing, they have to go through 10 different agencies and paperwork for each program. And it really becomes, a burden for them, and it discourages them a lot on the continuity. So by creating this one-stop shop, we want to minimize that, right? Versus taking you to 5 different agencies, which our outreach workers are actually doing right now. We want to have all of you on site as much as you can and provide some of those services that are relevant to the homeless population from Bethany House. For now, today, so we're doing this in 2 phases. The resource center will open hopefully within 2 months. That's our target. The rest of the facility, meaning the courtyard, we're trying to create a very inviting and comfortable space to engage people during the day. Meaning that instead of them being out in the streets, that they can be there, be, comfortable enough that they can, that we can keep them engaged with classes during the day, case management, So if you have any ideas of activities that, for example, New Works, I know that they step up, but she's maybe considering financial literacy, It could be all kinds of classes or group sessions. So again, that we can keep them engaged during the day. And so the restrooms and the dorm, so the rest of the facility will open towards the end of the year. But I do want to open the opportunity right now, as of today, to feel free to make use, to approach us if you want to promote your programs or you want to enroll to certain services. Our meal times. I always say you have a captive audience there of 150 people every meal time. We serve every day, breakfast 8 to 10, lunch 12 to 1, dinner 4 to 5. And it doesn't have to be any formal, calendar. Some agencies are very supportive of us, and we just they just notify us, okay, we'll be there. But the meals are served regardless, so you always have that opportunity there to promote your services. But also, we're always open to making sure that we bring the service, like I said, to the facility. So if you ever want to schedule a presentation or whatever it is, or if you already want to start, okay, like for example, Gateway. The clinic has a mobile unit there every Wednesday. They're providing the services. Pillar is providing counseling on site already. So if you envision that a certain component of your services can already be implemented at Bethany House as we are today, we encourage you to do so. If you have other services where your target is the homeless population and you have a hard time reaching the client, please make use of our outreach team. They're out on the street every day. We know them by name. We know what they need, what their challenges are. So I'm gonna give you, I think, the outreach person is Rosa Espinosa. And let me give you her working number. 956-754-3038. So again, I know it's very challenging when you're, that you cannot find the person, but that person is interested and that there's this gap. Even if it's not a service directly connected to Bethany House, we're always willing to help you find them, to give you certain references where we last saw them, etc. But yes, that is a plan. We're very excited for it. I think it's, again, just the commitment from the city. This is 100%, the construction part is fully funded by the government. So that talks about the commitment from the city to support. We have a commitment to help us with a portion of the operations for 5 years. So again, that talks about the commitment, and we have, we've talked to most of the agency directors who are on board with bringing your services to our resource center. So we look forward to working even closer with all of you.
Ms. Monica, what does the homeless population look like?
So the number is ranging from 300 to 400. As you know, it's a very fluid number. This is based on our annual point in time count, which is actually not a full census, but it is just like a sample number, or you can consider it as the minimum number of homeless individuals in your community. The last number was close to 350. There is a misconception that most of the homeless population is from out of town. It is not. It's 75% local, 25% from out of town. But probably you remember more the person that is panhandling that lives from out of town, and that's the one that you think. But you don't see a lot of the people that look just like you and I, and that are kind of overseen. It's also, the greatest need is on the male population, 75% men, 25% women. To give you an example, every night we're having 40 men requesting shelter services and about 5 women. So the difference is quite big. So when you think of any services, we always say think of things that are, for example, clothing, right? We have much more of a demand for clothing for men than for women.
And you accept donations for clothing and hygiene and?
We do, we are always
Which
open.
items are you,
So our priority is items for men, adult men. We are limiting the children and the women. We have enough of that and we're limited in storage. We always take in hygiene items or other essentials like in the heat wave. We always welcome bottled water, essentials like that. In the winter, of course, we ask for blankets, sleeping bags. And also we're always open to if your client needs a change of clothes, come to us, right? Or if they need a bus pass, we're very limited, but we can always make sure that they have one for a critical service, or if they need food delivered to their home, we do that as well. So any essentials that your client might need, just always feel free to contact us.
Thank you very much for your presentation, very important. I think the importance of having to come to these meetings is to let you all know if they have anything upcoming or anything has changed, or anybody that may or may not be able to be present, they can look at these videos and know that these services are available in our community. Are there any questions for Ms. Monica Bautista? Any comments? Okay, thank you very much for your presentation. At this time, I'm going to go around the table and ask all of our stakeholders if they would like to share their program information and or any updates on anything that's going on. You're more than welcome to do so. So if you're here and you'd like to say or share anything, please do so that we can note it for the record.
I left in your place an invitation for the 5K run. If you all want to join, you're welcome. If you want to set up a booth also, I left the registration there. Please email it to me. Go ahead and email it to me, please, so I can know how many booths we're gonna be needing. We are gonna provide a table and 2 chairs from the city, thanks to the city of Laredo. Also, I'm still looking for sponsors. I have 7 more days. We have 200 for bronze, 300 for silver, and $500 for gold. So if anybody wants to sponsor, please let me know. Thank you very much.
Well, I have one question.
Yes,
The
sir.
QR code doesn't work, I tried to scan it.
Oh, yeah, it doesn't.
Yeah, it doesn't work.
Okay, I'll contact the person and let them know. Because I did it like yesterday and it was working.
It looks awfully. It looks awfully.
When you make a copy.
Oh, maybe in the copies, okay.
When you make a
Okay, can I send one flyer to you and Jimmy, can you send it to them? Okay.
The one you sent, I think the one, the email, that will work.
That will work, okay.
Right.
I'll send it to Miss Angie and I'll have her email it to everybody. Okay, or if you need it, Pastor, you can text me your number. My phone number is right there and I can text it to you.
Thank you.
Thank you.
Thank you, Marina. Anybody else with comments or information on your agency?
I wanted to just report, reminding everyone that SCAN does have 2 adult facilities for residential treatment. They range from 30 to 90 days, one for adult male and females. They are in Rio Bravo. We also have an adolescent one for males, also ranging from 30 to 90 days. We also have a lot of prevention, intervention, treatment, trauma, parenting programs. A lot of our programs actually do home visits, do transportation, we do case management, and I know sometimes those are the barriers. So just reminding everyone that those services are available sometimes for the intake. Our case managers, even our counselors, will go to the house of the individual, take them the consent forms. Once they sign it, they're allowed to transport them. So just a reminder, we are getting a lot of state programs right now, but it's more for early childhood development. So maybe for the adults that you all are treating, they can get parenting services or even counseling services for the children. And we have the drop-in center recovery support services. They're now 24/7 again. So they were 24/7, they stopped, and now they're back. So I think that's really important because most of our agencies are Monday through Friday, and we know that the weekends is when the support is needed the most. So they can call the drop-in center. They also have the Narcan available to distribute, do the education for anyone.
I work with SCAN as well, so we have the subjective math program, and then if you guys want to send us referral, we're taking referrals too, so, again, I think it should, if you want to send us consent as well, we can share the information with them, and I think where they're at on that, you as well. And then I'll give you my contact information if you guys need it, I'll stay behind, so you guys can get that as well. I did want to announce that we also have a Frontera program who's providing HIV and Hep C testing every Tuesday and Thursday from 4 to 6 p.m. at the Hendricks location for SCAN. It's free to the community, so if anyone wants to go, by all means, feel free to send your comments or stop by yourself and test you.
Thank you. Anybody else that would like to share?
Yes.
Johnny,
Good afternoon. So with WestCare, through DFC Face Coalition, we're hosting a 1-hour workshop on July 25th for youth, trying to target middle school to high school. It's free, and we'll provide 5 hours of community hours to them. So it's at Las Promesas de Laredo at 2110 Lomas del Sur, Suite 101, and from 2:30 to 3:30. So if anybody's interested, you can contact me. I'll send you the contact information so that if anybody's interested for you, they can let me know so that we can have enough people that we know that we're gonna attend, so we can have enough snacks and stuff. It's gonna be on vaping of synthetic marijuana. And it's gonna be an LPC, LCDC that's gonna present. So it's very good information. It's on prevention.
Thank you so much for that information. If anybody's interested, please reach out to Mr. Ariston. Anybody else that would like to share information on your program or services that you all have? Otherwise, then I ask you to, yes.
I just wanted to thank those that participated last month on the harm reduction training that we had. This is our second harm reduction, principles of harm reduction. The first one was on safety and outreach for harm reduction. So we will continue to provide trainings on harm reduction as the promotion specialists continue to go out in the community to have the Never Use Alone campaign, information on never using alone. We'll implement another knock and talk. I'm thinking by the month of December, we'll have our next knock and talk after the back to school dies down. We'll be out there in the community for the next one. And we'll continue our outreach events to promote treatments and in this case, the majority of it is harm reduction here. That's it.
No, thank you very much. As a matter of fact, I was in that training and I learned a lot more. I think, and I always say it, the more that we know, the better heard that we are. And I actually have the next question or concern for Mr. Hurd. I heard yesterday there was a concert at Casablanca, and there was several individuals that had fainted because of maybe drug use. I don't know if that's any true or like there's any truth to that. But is there an opportunity for the city of Laredo to put out information, maybe like a flyer, like in the restrooms at these locations where they could reach out or know what to do if they happen to be in a situation where potentially somebody who is using drugs needs support or help?
And right now we're actually working with the Laredo Chamber of Commerce. We provided them to give out to every single member that they have. I believe there are around 600 members to the Chamber of Commerce. And we are providing them with stickers to put in the room. Research has shown that that's the place where you want this kind of information. But that one is mainly for mental health, right? So talking about that, if we already have the collaboration with Chamber of Commerce, maybe we can work on some things that has on the other side of the because it's usually in the mirrors on the restaurant. So maybe we can incorporate something with that information. I will talk to Dr. Chamberlain to see if we can approach that because mental health and substance use do go hand in hand. And we're already working diligently with 98 and mental health, including the component of substance use.
The more common area is obviously a restroom, because even at that, the restroom already has the human trafficking posters, and those are mandated by the state. So there's still a lot in there. But any way that we're able to reduce the potential use or just providing more information, I think that would be great, but I don't know if that was any truth or anything like that, but I had inquired about how the concert had gone, and there was over 700 people in attendance, and there were several people that were deliberately using in public. So I think, you all may have been called out or not,
I can check with my EMS operations. They usually get like anything for coincidence, they get updated calls like on the spot, so when I go back right now, I'll ask.
Alright, thank you. Alright, so everybody's rushing out, I'm so sorry, the meeting finishes at 1, but I will go ahead and close this meeting at 12:54 before we lose quorum. I ask that you all RSVP to food, as you're walking out, so that we don't have anything left over. If I could please have a motion to adjourn, the first and a second. I have a first by Marina, do I have a second? Left. Thank you. All in favor? Any opposed? Motion passes.